If you experience extreme anxiety before going on stage, speaking in front of a crowd, or performing for an audience, there's a fair chance that you suffer from performance anxiety or stage fright. And you're not alone. In a recent video about public speaking, we shared that around 75% of the US population struggles with a fear of public speaking to some degree, which means that over 200 million people get really nervous about talking in front of others, and many more fear performing or playing instruments for an audience. Given that performance anxiety is so widespread and stops so many people from doing what they need to do in front of groups or crowds, it's not surprising that people who need to perform in front of audiences for their work began to use prescription medications to help manage the constant anxiety and performance burden. One such medication that helps performers manage their anxiety, and it's regularly used off script, meaning for another purpose than what it was medically designed for, is a beta blocker called Metoprolol. Back in the late 80s, the International Conference of Symphony Orchestra Musicians surveyed its members and found that 27% of them were using beta blockers like Metoprolol and propranolol to help manage their performance anxiety, and the number is believed to be between double or triple that today. So what's going on? For performers and those whose lives or careers revolve around performing in front of people, why are they using these beta blocker medications like Metoprolol so much? What do these beta blockers do to the body? Are they safe, and are there any side effects? Let's find out. A quick disclaimer. You're probably watching this because you've heard about this medication that helps people with performance anxiety, and you want to know how legit it is. Well, I'll give you the short answer first. Metoprolol is a legitimate medication that can help with stage fright and anxiety, but anyone who does use the medication needs to be aware of the potential side effects and risks. Both are typically minimal, but we don't recommend using any prescription medication without fully understanding how it works and what downsides to look out for. That being said, this is not medical advice, and anything we share here is purely for educational and/or entertainment purposes only. Before using Metoprolol or any prescription medication, ensure that you speak to a licensed medical professional. Consult them about your plans and make them aware of any medication programs that you're currently on, so you can avoid any negative interactions and come up with a plan that uniquely works for you. What is Metoprolol? Metoprolol, chemical name metoprolol tartrate, falls under the drug class of cardioselective beta blockers and is a B1 or beta-1 adrenoreceptor blocking agent. In short, Metoprolol is a beta blocker. Around 1978, the FDA approved the use of Metoprolol under the brand name Lopressor. Today, Metoprolol can be found in oral tablet and capsule form under the brand names Capspargo Sprinkle, Toprol XL, and of course, Lopressor. The main reason that Metoprolol is prescribed by doctors is to treat high blood pressure and similar cardiovascular conditions, and it's prescribed at least 27 million times each year in the United States. How Metoprolol works for anxiety. Research shows that 20 to 30% of musicians in the world today use beta blockers like Metoprolol to deal with performance anxiety. Most of the professional performers who take Metoprolol do so to manage the physical symptoms of anxiety and to prevent the body's fight or flight response that comes with being nervous. The physical symptoms of performance anxiety are things like excessive sweating, rapid heartbeat or heart palpitations, sweaty palms, and trembling of the lips, hands, knees, or voice. And the fight or flight response is the body's natural primal response to stressful situations, where faced with perceived danger, our brain and body start to prime for a fight or for a sprint to safety by dumping stress hormones into the bloodstream. Metoprolol reduces physical symptoms of performance anxiety by lowering the stress levels on the cardiovascular system. The medication reduces the force with which the heart pumps blood, creating an overall relaxing effect. And the beta blocker Metoprolol prevents the debilitating effects of a fight or flight stress response by blocking the effects that adrenaline can have on the body. Adrenaline is the primary stress hormone, and it binds with beta receptors in the heart, making the heart pump faster and harder when adrenaline is released in the system. By limiting the release of the adrenaline hormone, beta blockers like metoprolol prevent the heart from pumping faster and harder, allowing the body to keep blood pressure steady, reducing any stress on the cardiovascular system, and overall reducing, sometimes completely eliminating, any performance anxiety symptoms, meaning no stage fright. Metoprolol dosage. As stated, none of this is medical advice, and you should always consult a licensed medical professional if you're even considering using prescription medications for any purpose. For reference purposes only, perhaps as a baseline to discuss with your doctor, typical recommended metoprolol dosage for anxiety purposes is between 50 milligrams per day and 100 milligrams per day. You have to be very careful to listen to your doctor regarding dosage, as taking too much metoprolol can absolutely slow down your heart rate to dangerous levels and cause breathing difficulties, dizziness, and possibly tremors. Again, this is not medical advice, and you really need to speak to a licensed doctor regarding metoprolol dosage for anxiety purposes. Metoprolol risks and downsides. Broadly speaking, metoprolol and beta blockers in general are widely considered as safe to use. But, as with all medications, every person using them is different, and there are some side effects to be aware of, even if they are rare. The main reported issues with metoprolol are nausea, sweating, heartburn, dry mouth, irritability or mood swings, and gut issues like bloating, gas, and constipation. If you experience more severe side effects from metoprolol, such as shortness of breath, fainting, or unexplained swelling of feet, hands, or ankles, then you should contact a physician immediately. I'll say that metoprolol, as a tool to assist with anxiety symptoms, doesn't have too many downsides. On the other hand, metoprolol does have several limitations, like number 1, it's only a temporary solution to performance anxiety, as it doesn't address the root cause of your stage fright. Metoprolol is only a quick fix to the physical symptoms of anxiety. Number 2, metoprolol requires a prescription. That means you must visit your physician every time you run out, which can be an inconvenience if you use it frequently. Number 3, metoprolol can interact with other medications, including antipsychotics, antidepressants, and other blood pressure medications. Consult with a medical professional if you're using metoprolol along with any of these medications. Number 4, while there is very little study on the use of metoprolol in pregnant women, animal studies show that metoprolol can be excreted through breast milk. Is there an addiction or dependence risk with metoprolol? Metoprolol isn't generally considered to be an addictive medication, but there is still a risk of developing a psychological dependence or reliance on it. For those constantly using metoprolol for anxiety, like those whose careers involve constant performances and high anxiety situations, they should consider looking at alternative methods for managing their performance anxiety over the long term so that they do not become too reliant on a prescription drug and its calming effects. On that note, viewers of this video can get a hold of the PerformZen Fear Workbook for just $1, down from the usual price of $27. It contains 6 simple anxiety-conquering exercises and techniques that performers all over the world have used to stay calm and focused under pressure. It's a quick but very valuable read, and you can learn more about it and buy for just $1 at www.performzen.com/fear. The link is also in the description below. Check it out. Summary. So we've talked about how metoprolol works to help performers overcome performance anxiety, and we've talked about the potential downsides and limitations of the prescription beta blocker. Let's summarize everything we now know about metoprolol. Metoprolol is a beta blocker, and beta blockers are a class of pharmaceutical drugs that block the effects of the adrenaline hormone, lowering heart rate, stabilizing blood pressure, and, for the purposes of performers or those facing stressful scenarios, helping overcome the body's fight or flight stress response and avoid, in some cases completely, the physical symptoms of performance anxiety. Metoprolol is available with a prescription under the brand names Capspargo Sprinkle, Toprol XL, and Lopressor. Many musicians, public speakers, salespeople, and other professionals use metoprolol and similar beta blockers to help manage their performance anxiety issues, with a reported 20 to 30% of musicians worldwide using the medication for anxiety purposes. While there are some reported risks, metoprolol is said to have minimal side effects when used for anxiety purposes. However, there are several limitations, namely that it's a prescription medication that requires consulting with a physician regularly to attain, rightly so. It's only a temporary solution to performance anxiety and doesn't address the underlying causes of anxiety issues. It can have negative interactions with some other classes of medication, and it can become a crutch or psychological dependence for some who use the drug regularly. I'll throw in a shameless plug here for the PerformZen Supplement. It's an all-natural formula specifically designed to be a natural alternative to prescription medications like metoprolol, helping performers stay calm under pressure and deliver excellent speeches, presentations, performances, and more in front of audiences of any size. You can find out more about PerformZen by going to www.performzen.com or by following the link in the description below. If you're interested in trying out a natural alternative to metoprolol, then PerformZen is just what you're looking for. Check it out.